Welcome back, everyone, for day 2 of the Innovation Experience. I hope you all are rested and ready for another full day of activity. Today we have a full slate of remarks, iEX talks, brain breaks, and plenary sessions to continue driving the conversations around the future of VHA as we all work to reimagine veterans' health care. Today's schedule includes remarks from several leaders, both within and outside of VA. We'll take part in a unique demonstration of augmented reality microscopes from a collaboration between VA and the Department of Defense. We'll also hear about the future of care delivery models, how to implement innovation into action, and several other topics. For those of you joining us here in person, we'll also hear from panelists on innovation in mental health, how to engage meaningfully with veterans and caregivers in the innovation process, and how VA serves as a connector between veterans and their care teams. For those of you streaming virtually, you'll hear from those speakers tomorrow. Now, to launch our second day at iEX, we're going to hear from another leader in VA who has been vital in progressing and advancing innovation across VHA, Dr. Shereef Elnahal. Dr. Shereef Elnahal is Undersecretary for Health at the United States Department of Veterans Affairs. He was nominated by President Biden and confirmed by the United States Senate on July 21st, 2022. As the Undersecretary for Health, Dr. Elnahal directs a healthcare system with an annual budget of approximately $102.2 billion, overseeing the delivery of care to more than 9 million enrolled veterans. Dr. Elnahal is a physician leader who previously served as President and Chief Executive Officer of University Hospital in Newark, New Jersey, from 2019 through 2022. Dr. Elnahal led University Hospital through the COVID-19 public health emergency. The hospital served as a model for urban hospital and regional response efforts. And in addition to his leadership during the pandemic, Dr. Elnahal oversaw substantial improvements in care quality and patient safety at University Hospital, leading to improvements against national benchmarks. Prior to his time at University Hospital, Dr. Elnahal served as New Jersey's first 21st Health Commissioner, appointed to the cabinet post by Governor Phil Murphy and confirmed unanimously by the New Jersey Senate. During his nearly 2 years as commissioner, he expanded the New Jersey Health Information Network, an interoperability platform that allows for electronic exchange of patient health information among healthcare providers. He worked closely with New Jersey First Lady Tammy Murphy on her Nurture New Jersey campaign to help improve infant and maternal health outcomes and reduce health disparities, a mission he continued at University Hospital with its top-tier maternal health services. He also made strides in curbing the opioid epidemic, granting funding to institutions to facilitate data sharing and public health reporting, and marked New Jersey as the first state in the nation to allow EMS responders to use buprenorphine in the field to prevent withdrawal from naloxone. Dr. Elnahal previously served as VA's Assistant Deputy Undersecretary for Health for Quality, Safety, and Value from 2016 through 2018, overseeing national policies around quality of care for the VHA, and as a White House Fellow in the VA from 2015 to 2016. During that time, he co-founded the VHA Innovation Ecosystem, a program that continues to foster the spread of innovation and best practices to improve veteran care across the nation. Dr. Elnahal holds an MD from Harvard Medical School and an MBA with distinction from Harvard Business School. Please join me in welcoming Dr. Shereef Elnahal.
Can we get a round of applause for Eric Bruns and everything the SimLearn Center does for VA? I had a chance to tour that amazing place. I think it was my second week after I went to the DAV convention. It continues to get better and better under your leadership, Eric. And thank you for also reminding me that I need to shorten my bio. Well, we'll get on that. Also, please give a round of applause to Dr. Vega and Dr. Clancy for their extraordinary leadership in being here today. This is deja vu to me. You all are my people. This is what I started doing in VA. And I just can't tell you how amazing the progress has been since I left. Right now, we've got a team of incredible people: Kit Teague, Beth Ripley, Blake Henderson, Allison Arnheim, Cole Zanetti, Scott Wiltz, and so many others who helped make this happen today. So please give them a round of applause as well. And importantly, we've got an incredible collection of stakeholders who are amplifying this important, innovative work and making veterans aware of that work and allowing veterans to benefit even more. We have the press here, we have interagency partners like DoD, CMS, we have industry partners, we have academia, we have VSOs. I saw Jose Ramos earlier from Wounded Warrior. These are incredible organizations that have their own networks of trust for the people we serve every day in this organization. So thank all of you as well for facilitating and enabling our innovation here. Please give all of them a round of applause. So I'll start by saying my journey in leadership, my ability to gain my own self-confidence that I can change organizations and inspire people to change on behalf of, I believe, the most important customers in the United States, veterans, started with this work. And I started this work with a simple hypothesis that with all of the problems we had to solve when I was first in VA back in 2015, problems around access, problems around getting community care streamlined and better, problems around hiring, issues with care coordination. The opioid epidemic was raging then, as it is getting worse now. Disparities in women's health. My theory was that the folks who know best how to approach these problems are the people in front of veterans and the people who are immediately there to support the care teams who are in front of veterans on the front line. And so what I did was I said, look, there's this innovation office led by an incredible group of leaders, Dr. Patrick Littlefield and Andrea Ippolito at the time. And we also have this ability to see what's already working in VHA to solve these problems in facilities and clinics and networks across the country. And the theory was, if we elevate and surface what's already working, and at the same time allow the most important ideas from the front line in VA to get from idea to execution with the innovation infrastructure that was nascent and being built at that time, that combination would be unstoppable. No longer would we have an approach where folks in DC, a small cadre of people, would get together and decide, this is how we were going to solve our problems. That was the way that people tried to do work in this organization since its inception. And suffice it to say, although daily excellence has been happening in this organization for decades, even longer, that top-down approach was not the way to do it. The way to do it was to have faith and deference to expertise, an important high reliability concept, in the people in front of vets who know the problems that need to be solved. So we get from idea to action, from idea to product, and when that product works, whether it's as simple as a process change or an IT tool that allowed for occupational health to better track flu vaccinations, all the way through to a complex set of training we did for residencies in women's health competency for clinicians across the country, something much more complicated. That entire spectrum of solutions was already there in VA. We simply connected the dots and built the infrastructure to bring incredible ideas to action on behalf of vets. And guess what? It worked. You're all here right now in the National Press Club because of that faith in VA employees in the front line. You're all here celebrating these incredible innovations and getting the word out about it because the Innovation Office years ago had faith that if folks were enabled and resourced by people who know a thing or two about innovation, that we would actually see that change happen to the benefit of veterans. And guess what? That hypothesis was right. You heard yesterday from the Secretary what our most pressing priorities are right now. And he had conversations with me throughout the weekend because he wanted to make sure that he was delivering the right message to all of you. And that message was based in a faith that he has, and that the White House has, and that the President has, and all of you, to be able to make progress on the things that we need to improve the most. And so you heard it from him. You heard our call to action. We have significant issues that need improvement on behalf of veterans across VA. But we also have incredible examples of excellence that are happening every day on behalf of vets. We're just trying to surface that excellence, bring it up, and spread it across the organization as much as possible. Let's bring these gears to work for what we've already identified as the highest priorities for system-wide improvement. We have to hire faster and more competitively, as the Secretary mentioned yesterday. I am so confident that people throughout the country in our system have figured out ways to do that we're not aware of yet. That's on all of you to help me figure out what that is. We have to get veterans the soonest and best care available to them. No matter where that care happens, no matter how we deliver it, that's our imperative to do that better system-wide. We have to serve our veterans with toxic exposures. The historic legislation that the President signed on August 10th of this year is perhaps the largest expansion of veterans' benefits in this country's history, with a cascading set of milestones and timelines for which so many veterans are going to qualify for VA health care. How are we going to deliver those benefits? How are we going to make sure our system is prepared to meet the need for those vets? I need you all to help me figure that out. Because if we don't execute on this historic legislation, that is a major missed opportunity on behalf of vets. We have to support veterans' whole health, their caregivers, their survivors, and afford our veterans who are homeless with stable and affordable housing. The social determinants and the networks of support that surround our vets need to benefit from your work. We need to also prevent veteran suicide, our top clinical priority. These priorities and others are pushed forward and enabled with something I've already highlighted as a strategic enabler, which is this. And that means all of you. If every leader in the country, medical center directors, network directors, program office leaders, people who are ultimately responsible for creating that supportive environment of care on the front line on behalf of vets, if they know that you exist, and if they know the encyclopedia of amazing work that you can offer, there is no doubt in my mind that we can meet this need for vets across the country, because that's why we are here. So my confidence in you could not be higher, no pressure. But my ask to you is to take this important work, amplify it as much as possible, and then focus your subsequent rounds of work on the things that we know we need to improve on. The vets that we serve depend on it. All of the stakeholders who carry and lift their voice to the press, to us in DC, to Congress, our partners in Congress, all depend on you to make this happen. I am not exaggerating. This is where the set of solutions lie. It's with all of you, and I am looking forward to seeing and hearing about the amazing presentations that happen today, and then tomorrow with the Shark Tank, one of my babies that I'm very, very proud of. Thank you so much, everybody. Appreciate it.